Hey there viewers, welcome to another amazing video of Health Shots. Athletes frequently experience chronic lower leg pain resulting from medial tibial stress syndrome, Shin Splints or exercise-induced compartment syndrome. Though the latter is an uncommon diagnosis, people often get confused between Shin Splints and compartment syndrome, particularly who involved in running sports. Compartment syndrome is also frequently mistaken for Shin Splints because of the similarities of their symptoms. So today we'll focus on understanding these conditions a bit better to differentiate between the two. Are you ready to dive in? Let's get started. Before that, hit the subscribe button for more amazing videos like this. Now let's get straight into the video. So let's begin with a small lesson on the anatomy of lower leg. There are 4 compartments in the lower leg area, comprising muscles, nerves, bone, arteries and veins. Each compartment is separated by fascia, which is fibrous connective tissue. Fascia is there to house all those nerves, muscles and blood vessels, protect them and keep them wrapped to work in harmony with each other. When the knee and foot perform any motion such as running, skeletal muscle contracts and the fascia surrounding the muscle expand to allow the muscle to contract. If the muscles are compromised due to low elasticity of the fascia, we will experience pain in the lower leg, which could either be Shin Splints or compartment syndrome. What is Shin Splints? Shin Splints is a relatively common condition. It refers to leg pain in the lower leg and is quite common in people who do vigorous weight-bearing activities, sprinters and beginner bodybuilders. However, despite being routinely used, shin splints don't represent a specific clinical pathology. It refers to chronic shin pain resulting from overexertion. Shin splints related pain occurs in 2 regions of the leg. It may occur in the proximal anterior lateral area of the leg, which is called anterior shin splints, or else it can occur in the distal medial region. When this happens, it is called posterior shin splints, or in clinical terms, medial tibial stress syndrome. The anterior shin splints is commonly confused with compartment syndrome as it also affects the same region of the leg. What is compartment syndrome? Simply put, compartment syndrome is a lower leg injury. It may be acute or chronic, depending on the intensity of the trauma to the fascia. Anterior compartment syndrome happens when the person gets a direct blow to the lower leg, but it may also result from overuse of the lower leg, such as running on a hard surface or changing the training intensity suddenly. Keep in mind that if the compartment syndrome occurs due to any shift in the training intensity, it will be called exertional compartment syndrome. Compartment syndrome versus shin splints, causes and symptoms. Between shin splints and compartment syndrome, the latter is a severe problem. It causes a lack of blood supply because of the extreme pressure it exerts on one of the 4 compartments of our leg. When the lower leg's fascia becomes inelastic, it starts confining in the space where muscles, nerves and blood vessels are enclosed separately. This causes the fluid to start getting retained within the compartment, generating more pressure and shutting off the blood supply. If this happens, rush to the ER because it is an emergency. Acute compartment syndrome doesn't just happen. It's usually because of the trauma to the lower leg like crush injury, hemorrhaging, bad muscle bruising from trauma or vascular occlusion. Sometimes prolonged exercise and post-surgical bandaging may cause acute compartment syndrome. So the compartment syndrome occurs when the sufficient blood flow doesn't reach a specific compartment within the lower leg, and muscles get enlarged due to increased pressure. This brings along a burning, aching pain along with weakness and numbness of the area. In contrast, a shin splints is a generic term. You can consider it a catch-all term for any kind of lower leg pain caused by jumping or running. Usually athletes brush off leg pains of shin splints because it is so common. It is often misdiagnosed for stress fractures apart from compartment syndrome because of their familiar symptoms. So what are these symptoms? Well, shin splints can cause muscle strain and inflammation of the bone's outermost layer, a condition known as tendinitis, which refers to the inflammation of a tendon. Shin splints cause pain along the inner or outer portion of the lower bone in the lower leg called the tibia. It is pretty common among runners, dancers, volleyball and basketball players, and those who wear improper footwear. Shin splints cause pain on either side of the shin bone with small nodular or lumps present alongside the muscle attachment. The pain usually occurs at the beginning of the activity and persists afterward. On the other hand, compartment syndrome symptoms increases as an individual engages in intense activity and subside within 30 minutes after the activity is ceased and the compartmental pressure returns to normal. That's one of the signs you can differentiate between the shin splints and compartment syndrome. Shin splints pain will intensify after the activity is ceased, and even when it's gone, there will be some soreness. Compartment syndrome causes persistent pain that may get worse if the injury or trauma is too intense. If the pain doesn't go away with resting, there is visible swelling within the impacted muscle, the skin is discolored or bruised, and you feel pain when you stretch the involved muscle, these are all signs that you need to see a doctor. If the case gets worse, you'll observe a decrease in pulses at the ankle and foot. In most severe form of compartment syndrome, the patient will feel numbness, tingling sensation, and lifelessness in the entire leg. So you see, both these conditions are different, and people cannot distinguish between them because shin splints and compartment syndrome affect the same region and result from similar issues. But it's crucial to differentiate between the two because treatment strategies for both differ, and this differentiation is possible only if you can accurately determine the symptoms and go through a medical examination. If you ever have experienced any of these conditions, please share it with us in the comment section. We are sure our viewers would love to get some first-hand tips to deal with the situation. Don't forget to like this video and subscribe to our channel for more amazing videos like this.